Good morning, it's Dr. Larson talking about COVID-19 in Kittitas County. So there's a lot of moving pieces going on currently. We'll touch base on those today. We'll talk about vaccination, which is the most important thing. We'll talk about where we're at in the county from a numbers standpoint. We'll talk about school reopening, and probably the biggest thing is to remember to be kind to each other. So I'm going to start with that. Everyone is having a hard time. COVID's been going on for a long time. People are tired. It's been really a whiplash type of a thing. If you remember back to July 4th, we were told everything's done. We've recovered from COVID. We can move forward. And all of us kind of felt a sigh of relief. We said, oh, life will be back to normal again. And then all of a sudden we had the Delta variant rear its ugly head. And we're all feeling the whiplash from that. So if your neighbor is having a hard time, please remember to be kind. If your coworkers are having a hard time, remember to be kind. Go back to what you learned in kindergarten about how we should behave towards others, because people are really struggling these days, and we should do a really good job of trying to listen, and especially trying to listen to people that have differences of opinion than what we have currently. So go to somewhere, share your feelings, share your frustrations, make sure that you're in a safe place and that you're listening to others. So maybe I should just end there on the be kind thing, and I'll end it the same way. But remember, that's probably the most important tool we have currently, is to be kind to others and look out for others. We've done a really good job in our community of that. That's why most of us live here, is because we have a community that looks out for each other. So remember to do that. Our COVID numbers are really high. We're in the high transmission rate. Our incident rate as of the 21st of August was 391. That's high transmission, both by the CDC, by the state guidelines, and that's where we are in the whole state of Washington. We're also in that situation in Oregon, and it's all the Delta variant. So the Delta variant is over 96% of all the cases that we're currently sequencing. And so that's what we're seeing. It's highly transmissible. The only good thing about the Delta variant, if you look at what happened in England and what happened in India, it goes up really fast. Lots of people get sick because it's very transmissible, and then it comes down really fast. So where are we in that process? We may be near the top. There's some question of whether or not there's some flattening of the number of cases that we have, but we're still getting here in Kittitas County about 20 cases a day on the average, which is really high, which means that we've got lots of transmission that's occurring. Hopefully we'll be coming down. Hospitalizations are high, and they're especially high in eastern Washington. Beds are full. Nurses are tired. Nurses are stressed. Doctors are tired. Doctors are stressed. We are taking transfers to our hospital from other places that don't have ICU beds. So we had a COVID patient get transferred from Colville. That means that there were no beds in Spokane, there were no ICU beds in Wenatchee, there were no ICU beds in Yakima. So lots of COVID out there, lots of stress. Make sure that you're being kind to others, and do something nice for people. This particular variant is being transmitted in kids. So unlike the Alpha and the original variants, which we've had a lot of cases of those, that wasn't transmitted very well with kids. This is transmitted really well with kids, both from parents to kids, from kids to parents, from kids to teachers, etc. And that's causing people to be anxious about school. So school boards, school superintendents are working really hard at making schools safe. If you have any questions about specific things that your school district is doing, you should address those questions to your school district. So if you're going to the Ellensburg School District, you can address those to the Ellensburg folks. If you're going to Kittitas, you should call the Kittitas superintendent. Those are the folks that are making those protocols for keeping your kids and your staff safe. So lots of stress though in regards to the Delta variant and kids. We also have lots of things happening. All of us are out. We're going to fairs, we're going to parties, we're going to funeral services, we're going to weddings. And make sure that you're being careful in those settings. Make sure that you're masking when you can't keep 6 foot social distancing, especially if you're going to be inside. Make sure you're wearing a mask inside, and make sure you're taking good choices, making good choices for you and your family to be safe. We are seeing a lot of breakthrough cases. That the definition of that is somebody who's fully vaccinated who still gets COVID. That's probably because of 2 reasons. One is that the Delta variant is very infectious, so we're getting a high viral load when we are exposed to somebody else. And the other is, it appears that the vaccine efficacy, the effectiveness of that vaccine is waning over time. So you're looking at things like booster doses and 3rd doses, and we'll talk about those in a minute. The good thing is, the people that are ending up in the hospital are still those people who are unvaccinated. The people that are dying are still those people that are unvaccinated. So please consider getting vaccinated if you haven't already. The vaccines are safe. We've given 187 million doses of the mRNA vaccines in the United States. That's Pfizer and Moderna, and we have not had 1 death of those vaccines, from those vaccines. We did have a few deaths from Johnson & Johnson vaccine. That's a different kind of vaccine. That was related to clotting, but the vaccines are incredibly safe, and please consider getting vaccinated, even though we're having breakthrough, because those vaccines are keeping us out of the hospital. They're keeping us from dying of COVID. 3rd doses. 3rd doses are currently recommended for somebody who's seriously immunocompromised, such as somebody who's had a heart transplant. Those people probably never developed an immune system boost from the vaccine. They need a 3rd dose. Coming September 20th, we probably will start giving 3rd doses or booster doses, if you want to consider those, to people that have had their vaccine over 8 months. That's because of some data that shows some waning immunity. The CDC and the FDA have still not approved that yet, but we are looking forward, and we are planning for the opportunity to do those doses. Currently, you can get vaccinated at your physician's office. You can get vaccinated at many pharmacies in town. We may or may not be doing another mass vaccination clinic in regards when that time comes about. But stay tuned, more to come. If you are a immunocompromised person currently, you are due for a 3rd dose of vaccine. The other thing that we have still on the table is, when are vaccines going to be available for kids 5 to 11? We don't know. The CDC and the FDA asked for more data. Whether that more data need is going to delay the release of vaccination for kids 5 to 11, we don't know. But I would say maybe at the earliest in October we would have that available for those people. The other thing that came out this week is the FDA fully approved Pfizer vaccine. What does that mean? That means they looked at all the data prior to this. They looked at data. We were at the beginning of the pandemic. We needed to stop people from dying. They had an emergency use authorization. They had to have a whole bunch more analysis of data that occurred looking at full approval. So currently Pfizer is fully approved by the FDA. That means that those people that were waiting to have full approval, worried about safety, that's been fully approved. So please go out and get your vaccination. And that's kind of where we're at with vaccine, other than the fact that K through 12 kids are getting ready to start school. The kids that can be vaccinated, 12 to 17, in those age range, we only have 21% of the kids 12 to 17 vaccinated in Kittitas County. That means that there's a lot of kids that are susceptible to COVID-19. So please, if you're a parent, talk to your physician, get valid information in regards to the vaccine. They should be your trusted source of information, and take your kid in to be vaccinated so we can reduce the risk on others. So that's kind of where we're at. We have a lot of things coming up, a lot of people that are being stressed, probably to the limit of what they can actually tolerate these days. So please be kind, do something nice for others, and take care of yourself. Thanks a lot.